8 critical colon cancer symptoms you should never ignore. What is causing the rise in cancer rates, especially colon cancer? And why is this troubling trend not limited to the older population, but increasingly affecting younger people as well? Today, we delve into this concerning trend and ignite a meaningful discussion. Be sure to stay until the end, as we will cover a list of the most common colon cancer symptoms that you might be experiencing. Colon cancer ranks among the most devastating diseases in our time. It is the third most commonly diagnosed cancer and the second most fatal. What makes the fight against this disease even more complex is the formidable industry built around it, an industry driven by money, misleading advertisements, and an overwhelming amount of information that leaves both patients and healthcare professionals puzzled and often wrong. A common misconception is that genetics primarily determine your risk for colon cancer. While having a family history can increase your risk, accounting for 5 to 10% of cases, this is far from the whole picture. Genes may load the gun, but it is our lifestyle choices that pull the trigger. Therefore, modern research is increasingly highlighting the impact of diet and lifestyle as key factors in preventing or even reversing the disease. Foods rich in antioxidants, for example, are now being acknowledged for their role in fighting various chronic conditions. This is not mere speculation. It is a fast-growing area of scientific research indicating where the future of medicine is headed. We will explore 8 critical colon cancer symptoms. We'll also cover the risk factors that accelerate the transformation of polyps into cancer and share practical tips on foods and habits that can help prevent colon cancer. Plus, we'll explain the importance of regular colonoscopies for early detection. Now, let's begin with the symptoms. Number 1, blood in stool. When blood appears in your stool, it can be due to various factors such as hemorrhoids, anal fissures, or gastrointestinal bleeding from other sources. Hemorrhoids, which are swollen blood vessels in the rectum or anus, are a common cause of rectal bleeding. Similarly, anal fissures, which are small tears in the lining of the anus, can also result in blood in the stool. These conditions, while concerning, are generally not associated with colon cancer. On the other hand, gastrointestinal bleeding can originate from different parts of the digestive system, including the stomach, small intestine, and colon. This bleeding may be due to ulcers, diverticulosis, or even colorectal cancer. The crucial aspect is to differentiate between these causes and recognize when to seek medical attention. The type of blood in your stool can provide valuable clues. Bright red blood in the stool often suggests bleeding near the rectum or anus, such as from hemorrhoids or anal fissures. In contrast, dark, tarry, or black stool may indicate bleeding further up in the digestive tract, possibly from the colon or stomach. It's important to note that blood in the stool can sometimes appear as streaks or be mixed in with the stool, making it less conspicuous. Number 2, diarrhea. While constipation can be a concerning symptom, the opposite, diarrhea, is equally important to consider, especially when it is persistent and unexplained. Diarrhea is characterized by frequent loose and watery stools, and it can have various causes, including infections, dietary choices, or underlying health conditions. Colon cancer can lead to chronic diarrhea when the tumor obstructs the normal passage of stool through the colon. In such cases, the body may respond by increasing the frequency and looseness of stools, resulting in diarrhea. It's important to recognize that chronic diarrhea should not be ignored, as it can lead to dehydration and nutritional deficiencies. Chronic diarrhea can be debilitating and significantly impact your quality of life. Number 3, unexplained weight loss. It's essential to understand that significant weight loss without a clear explanation is not a normal occurrence. Generally, healthcare professionals consider weight loss of more than 5% of one's body weight over a span of 6 to 12 months to be unexplained. While there can be various reasons for unexplained weight loss, it's vital to consider the possibility of an underlying health issue, especially when combined with other symptoms. Colon cancer can lead to unexplained weight loss for several reasons. First, the tumor can impair the absorption of nutrients in the colon, leading to nutritional deficiencies. Additionally, the body's immune response to the cancer can increase metabolism, causing a person to burn more calories than usual. Number 4, rectal bleeding. Rectal bleeding specifically refers to the presence of blood that comes from the rectum or anus. It may be noticeable on toilet paper after wiping or in the toilet bowl. The color of the blood can range from bright red to dark red, depending on its source and the time it spends in the digestive tract. Rectal bleeding can be associated with various conditions, including hemorrhoids, anal fissures, or gastrointestinal bleeding. Hemorrhoids, which are swollen blood vessels in the rectum or anus, are a common cause of rectal bleeding, particularly when the blood is bright red. Similarly, anal fissures, small tears in the lining of the anus, can result in rectal bleeding. However, when rectal bleeding is persistent, severe, or associated with other concerning symptoms, it should raise a red flag. It could be a sign of an underlying issue, including colon cancer. Colon cancer can cause rectal bleeding when the tumor bleeds into the colon or rectum. This bleeding can result in dark or black stools as the blood has time to mix with the stool as it travels through the digestive tract. In such cases, rectal bleeding can be a late-stage symptom of colon cancer. Number 5. Fatigue. Fatigue associated with colon cancer is often more than just feeling tired. It can be extreme exhaustion that interferes with your daily activities and quality of life. This fatigue may be accompanied by weakness and a lack of energy. The connection between colon cancer and fatigue lies in the potential development of anemia, a condition characterized by a reduced number of red blood cells or a low concentration of hemoglobin in the blood. Anemia can result from colon cancer when the tumor causes bleeding in the gastrointestinal tract, leading to iron deficiency and a decrease in red blood cells. The result is a decreased ability of the blood to carry oxygen, which can lead to fatigue. Number 6. Anemia. Anemia is a condition where your blood lacks enough healthy red blood cells to carry an adequate supply of oxygen to the body's tissues. It can result from various causes, including nutritional deficiencies, chronic diseases, and bleeding disorders. One of the potential causes of anemia, especially in the context of colon cancer, is gastrointestinal bleeding. Colon cancer can lead to anemia when the tumor causes bleeding in the gastrointestinal tract. This bleeding, often unnoticed, can gradually result in a significant loss of blood, leading to a decrease in red blood cells and reduced capacity to transport oxygen. The result is anemia. The symptoms of anemia can vary, but often include fatigue, pale skin, shortness of breath, and cold hands and feet. It's essential to recognize that while anemia can be a symptom of colon cancer, it can also be caused by other health issues, such as nutritional deficiencies or chronic diseases. Number 7. Abdominal pain or discomfort. Understanding the nature of the pain and its location can provide valuable clues. Abdominal pain due to colon cancer is often described as crampy, intermittent, or persistent. It can be located in the lower abdomen and may sometimes be associated with bloating. It's important to note that abdominal pain is a nonspecific symptom, which means it can occur in various conditions other than colon cancer. Gastrointestinal issues such as irritable bowel syndrome, IBS, diverticulitis, or gastritis can also lead to abdominal discomfort. In some cases, abdominal pain associated with colon cancer may be accompanied by other symptoms such as changes in bowel habits, unexplained weight loss, or blood in the stool. These combinations of symptoms can be particularly concerning and should prompt immediate medical attention. Number 8. Constipation. Constipation is a common digestive issue that most people experience at some point in their lives. It's characterized by infrequent bowel movements, difficulty passing stool, or hard, dry stools. In many cases, constipation is a temporary problem that can be resolved with dietary and lifestyle adjustments. However, when constipation becomes chronic and is accompanied by other concerning symptoms, it should not be ignored. Chronic constipation is defined as having fewer than 3 bowel movements per week and experiencing these symptoms for an extended period. Colon cancer can cause chronic constipation due to the tumor's presence in the colon, which can obstruct the normal flow of stool. As a result, you may experience difficulty passing stool and a decrease in the frequency of bowel movements. It's important to distinguish between occasional constipation and chronic constipation. Occasional constipation can result from dietary choices, stress, or other temporary factors. Risk factors for colon cancer. Several factors contribute to the accelerated transformation of polyps into cancer, such as ultra-processed foods, Excessive consumption of red meats, especially those that are more processed, like sausages, salami, and ham. Bad fats, excessive vegetable oils, except olive oil and a few others, sugar, and excessive sodium. These products, particularly when they come from ultra-processed foods, are like adding fuel to the fire for tumor growth. Ultra-processed foods have been officially declared carcinogenic for some time now. Other contributing factors include constipation, poor or inadequate intestinal flora, microbiota, and chronic inflammation. Additionally, habits like alcohol consumption and smoking are also known to be carcinogenic. Foods and habits to prevent colon cancer. To reduce the risk of colon cancer, it is advisable to maintain a diet rich in anti-inflammatory and antioxidant foods. This includes consuming a variety of colorful fruits and vegetables daily. Spices like turmeric offer excellent anti-inflammatory and antioxidant benefits. Healthy fats, such as omega-3s found in fish like salmon, tuna, sardines, and anchovies, or in plant sources like chia, flaxseed, and sesame, are also recommended. Avocados and eggs from free-range chickens are other good sources of healthy fats. Addressing constipation is another way to reduce cancer risk. Consuming enough water and fiber can help improve intestinal flora. Other healthy lifestyle choices that are often overlooked include getting adequate sleep, exercising regularly, and increasing social connections, all of which have antioxidant and anti-inflammatory effects. Foods like nuts and seeds, including pumpkin seeds, are also beneficial for intestinal health. Now let's talk about diverticula and diverticulitis. You may wonder if you can consume seeds, nuts, and the hard outer coatings of some seeds and nuts if you have these conditions. The answer is yes. Contrary to popular belief, a comprehensive study involving more than 47,000 patients found that consuming these foods does not increase the risk of diverticulitis or its complications, such as bleeding. As a result, it is no longer recommended for patients with diverticulitis to avoid these foods. On the contrary, such foods can improve intestinal flora and function and may even help prevent colon cancer. However, each case should be individually evaluated, so if you have any intestinal issues, consult your doctor. Colonoscopy. What is it, and who should get one? A colonoscopy is a medical procedure designed for the early detection of colon cancer. During this procedure, a long tube equipped with a camera at its tip is inserted into the intestine through the anal region. The camera navigates the entire length of the intestine, searching for abnormalities such as polyps, tumors, or lesions. If a polyp is discovered, it is removed and sent to a laboratory for analysis to determine if it is benign or malignant. For the patient's comfort, the procedure is performed under sedation or mild anesthesia, so most patients don't experience any pain and often don't even remember the procedure. It is generally recommended for all individuals to start undergoing colonoscopies at age 45 or 50. However, if you have a family history of cancer, you might need to begin screenings earlier. The frequency of subsequent procedures is usually every 10 years, unless your doctor advises otherwise. While the procedure is considered safe, there are some risks, such as bleeding or injury to the intestinal wall. However, these risks are minimal, occurring in only 1 or 2 out of every 1,000 procedures. If you liked the video, give us a thumbs up and share it with your friends. Write your opinion in the comment section, and for those following us for the first time, subscribe to the channel and turn on the notification bell to receive all new videos. Thanks for watching, and goodbye.